Good evening. I'm Rodney Rogers, president of Bowling Green State University, and we are coming to you live from University Hall on the Bowling Green campus of Bowling Green State University. And tonight we want to have an opportunity to share with you some of our planning for this summer and into the fall. With me tonight is Ben Beatty, our Chief Health Officer. You'll have a chance to hear from Ben in a few minutes as well. But before we get into the program, just want to remind everyone that there's an opportunity for you to ask questions and such, and that we will respond to those questions, certainly as many of those live during this event. But other questions we may not get to, but we will collect those and make sure they're included and in our frequently asked questions that we're about to post and those sorts of things, so we can make sure that we're communicating with you as fully as we can, so you understand what our plans are for the summer and into the fall. You can post those questions in the event thread, so please do that on Facebook or YouTube, however you're viewing this tonight. So again, we're so pleased that you're with us tonight. And so for the families, the students and the families of current BGSU students, I just want to thank you. Thank you for your perseverance, adaptability, flexibility over this past year. We have asked all kinds of things as a community to come together and to find a way forward against this global pandemic. And I have to admit, I'm just so proud of our community, the way our students, our faculty, staff came together and found a way forward. With relatively very low positivity rates on this campus because of all of the processes, procedures, protocols that were put in place, but most importantly, were followed. You looked out for each other, you helped out each other, and we found a way forward. And I know we've got many incoming students perhaps listening in as well. And so I know that you've had a high school experience that's probably unlike any other. And so I'm sure because you are here where you are, ready to start your college education, you also found a way forward. And that is one of the important things in my mind of the Bowling Green community. We often talk about belong, stand out, go far. Part of that belonging is community, watching out for each other, being respectful, being courteous and kind to others, helping our community move forward. And that is something that I honestly think has been key for us as we've had relatively excellent success this past year during this global pandemic. And so I just wanted to make sure that we started with a note of thanks and gratitude for all that you have been through. So tonight really is about talking about the summer a little bit, and then, but most importantly, about expectations for the fall. It is also based upon what we know today and where we are today with COVID-19 and this global pandemic. Honestly, I think there's a reason for great celebration when you think of the progress we've made in terms of the vaccine, what we know so much more about this virus, and certainly we did a year and a half ago or a year and a couple of months ago. We certainly know so much more. And that is what we want to use as we're planning for the fall. As you also know, during this entire pandemic, we have always followed CDC and the Ohio Department of Health guidelines and recommendations, and we've always tried to follow that. But we've also tried to be respectful from a lot of different perspectives on this challenging issue, on this virus. That we've tried to be respectful of different views and perspectives, but looking to CDC and the Ohio Department of Health to ensure that we're following best practices and the preponderance of science that we are aware of at this point in time. And so I'm sure most of you know, effective June 2nd, Ohio Governor Mike DeWine has lifted many, if not all, of the various protocols with respect to face coverings, physical distancing, and limitation on event sizes and such. And CDC issued the guidelines where fully vaccinated individuals no longer need to wear face coverings outside or in the vast majority of indoor settings. But as we have also shared, and our plans for the fall will be that BGSU will not require students, faculty, or staff to get the COVID-19 vaccination. We will leave this up to personal choice. However, we do strongly encourage individuals that are able to get the vaccine to be vaccinated. But we also know there are those who may be unable to get the vaccine because of perhaps some medical conditions. And we want to be respectful of those individuals as well. But we would encourage those that are able to get the vaccine to get the vaccine. And we know based upon where our student body was this spring and what they told us was their intention, that a large majority of our students, faculty, and staff have either received the vaccine or plan to get the vaccine, but we will not require that at BGSU for this fall. But we also want to make sure that we're thinking about all the members of our community and how do we make those members of our community safe as we move to a fully in-person experience this fall. So this summer, there will be certain guidelines still in place with respect to face coverings with large groups indoor. And Ben's going to talk a little bit just about some of those policies this summer, especially for our summer orientation and registration that our newest students will be a part of, or some of our returning students may be here for some summer classes. But this fall, our intent is to be fully in person and have a very robust student life experience in terms of the welcoming weeks for our newest students and the fall welcome that we have, but that'll extend over multiple weeks, and a variety of in-person kind of experiences across our community, as well as making sure that our course offerings are being delivered in an appropriate fashion. And so to that point, many of you have already registered for classes. Those returning students registered for their class before they went home for the summer. I know the newest incoming students, you will be registering as orientation occurs over the next month or so. So our current schedule in terms of the delivery mode that's in the calendar of courses that you've signed up for was based upon the assumptions at the time when those courses were put into the system. So it was based upon 6 feet of distancing, face covering, and various other protocols. As we are looking at all of those assumptions we made, we're adjusting those assumptions for what we believe will be in place in the fall, which is limited or very little physical distancing will be appropriate to the capacity of our classrooms, those sorts of things. So the modality, the way the courses are being delivered will probably be adjusted. In fact, they will be adjusted. So you might be taking a remote course for the continuing students. You might be in a remote course for this fall that meets, let's say, Monday, Wednesday, and Friday from 10 to 10:50, and that's listed as a remote. That class most likely becomes a face-to-face in-person class Monday, Wednesday, and Friday from 10 to 10:50. We are reworking that schedule, and our plan is by mid-June to have all of those final classes nailed down, if you will, and the delivery methods solidified. Some of you may be taking hybrid courses. Some of those hybrid courses are partially in person, partially virtual. Some of those might also flip fully in person. What we want to do is not lose the innovation that has been made in terms of the pedagogy using technology to enhance a student's learning, but we also want to make sure, and I've heard this from so many faculty and staff, we want to make sure we get back to the opportunity to engage with one another, to learn from each other, to get the interaction among our students, which many times is best done in an in-person experience. So those are some of the things we're certainly planning for. This fall, though, fully in person, a very robust offering of student life. We will not be requiring the vaccine, but strongly encouraging it. For those individuals who are unable to get the vaccine, we want to work with you to ensure that we can provide you an environment that you're comfortable with. But we want to make sure that, most importantly, as a community, we find this way forward. It has served us so well over the last year and 2 months that we've talked through these issues and, as a community, found a way to successfully move forward during this global pandemic. And so with that, I want to turn it over to our Chief Health Officer, Ben Beatty, to share some comments and anything that I misspoke about. Ben, please correct me, but most importantly, to talk a little bit about some of the expectations and around the community public health on our campus this summer and then into the fall. Ben?
Thank you, President Rogers. I want to echo President Rogers' sentiment around thank you to our community. I think we really navigated this pandemic well, and that was to the hard work of everyone, faculty, staff, students, and families, and our outside partners to really come together to navigate something that we've never seen before. We're in a very different spot today than we were at this time last year, and it's actually an excellent spot to be in. We have learned so much about this virus and how to combat it and put ourselves in a much better position as we look towards this summer and the fall. So when we look at our COVID-19 case numbers here in Wood County, we're starting to see significant decreases week after week, and those decreases continue. We're driving the virus down to very low levels, lower than we've seen even towards the start of this pandemic. And so we really want to see this continue into the summer, and we're optimistic about this. We believe it's a true impact of the vaccine and the number of individuals that have come out to get vaccinated. And so we appreciate those individuals who have taken that chance. At the same time, we're watching trends across Ohio, and we're seeing very similar trends just across Ohio and across the nation. That's why the CDC came out and was very confident in being able to say that we can start to reduce some of these restrictions that we've lived under for the last year. And so these are all great things for us to look to. When we really want to focus on what we've accomplished this year, it's quite vast and quite amazing. Our partnerships really built through the public health systems and the healthcare systems to be able to combat this virus at every turn. So we now have the capability to test on a massive scale, much larger than we've ever had. And so if we need that, that's ready for us. At the same time, we've been able to roll out contact tracing, where we can very quickly identify cases, isolate and quarantine individuals to slow down the spread of this virus in our partnership with the Wood County Hospital and Wood County Health Departments. We also have the capability to vaccinate on a massive scale. And so we've been able to stand that up through these partnerships, our use of the Perry Fieldhouse, and vaccinating thousands of individuals across our community to really drive these case numbers down. These things will all still be in place for us through the summer and into the fall. And now we really are starting to have these tools that really allow us to open up, and we're confident in our ability to do that. So some of the changes that we're really looking at and we're seeing. So the CDC came out and said, vaccinated individuals, your risk level is much lower now than it ever has been. And so you no longer have to wear a mask outdoors or even in most indoor environments. So our policies will be changing starting June 2nd. For vaccinated individuals on campus, if you're outdoors or indoors in most settings, you don't have to wear a mask. That's your choice. At the same time, for unvaccinated individuals, we would still follow that CDC recommendation that you should wear a mask when you're indoors or outdoors in close proximity to other individuals. So we really want to make sure you're still protecting yourself if your risk level is high, because you don't have those antibodies at that point in time. As we look towards the future, the only time where we'll really ask people to wear a mask is when we're gathered in larger numbers. So when 10 people are getting together, 10 or more individuals are getting together, and we can't provide that 6 feet of distance, that's when we would recommend that people put their masks on, because we know in a larger gathering of individuals, there's probably going to still be a number of unvaccinated individuals that could be at risk for this virus. So throughout the summer, we want to operate from the standpoint where people still have an opportunity to get vaccinated and go through that series of vaccinations, especially if it's the 2-dose series, and have that time frame to get that protection. We also recognize that there's individuals within our campus community who can't be vaccinated, potentially because of an allergy or a medical condition or maybe a religious belief that they can't be vaccinated, but they still want to engage in public settings. And so in those larger gathering settings during this summer, we want to be respectful of those individuals. Mostly what I like to tell people, and I think this is just a good practice for when you're out in public, is we're still going to all carry that mask with us because we want to be respectful and compassionate of other individuals' wishes. So if we start to find that I'm interacting with somebody within 6 feet of distance and they're wearing a mask, it's probably a good practice for me to pull my mask out as well and put it on, to be respectful, because you don't know what their status is. Maybe they're vaccinated, maybe they're not, but maybe they're also immunocompromised. Maybe they're going through chemotherapy or have a loved one at home that they care for. And so if we all can find this way to be compassionate and respectful, I think we'll be able to have a really fun and much more open summer, and then really approach the fall where we want to be wide open. We'll be monitoring throughout the summer like we have throughout this pandemic, working very closely with the Wood County Health Department, the Ohio Department of Health, and the CDC, and the Wood County Hospital to monitor trends. If the case numbers continue to stay low like we're seeing, we anticipate we'll be able to open the fall semester with no requirements for masks because everybody will be at low risk in a very safe environment. If we have high enough vaccination rates, that provides us an opportunity where the virus just doesn't have a chance to take a hold in the community, and that keeps us in a good spot throughout the fall semester. Also monitoring variants as well. We're monitoring variants in other countries and what that may mean. We are always ready to pivot and monitor and modify our practices to make sure we're keeping everyone as safe as possible, but we're truly optimistic around what the fall is going to look like. So with that, Rodney, I'll turn it back to you and take some questions.
Great. I just wanted to, first of all, thank Ben Beatty again. I think Ben has been such a great addition to the leadership team at Bowling Green over this past year as he's overseen our health protocols. And I appreciate, Ben, your very common sense approach to dealing with these challenging times. I also want to make sure that we thank the entire I started by thanking the Bowling Green State University community, but I want to be clear of thanking the City of Huron, the City of Bowling Green, the Erie County Health Department, the Wood County Health Department, Wood County Hospital, the Ohio Department of Health. All of those organizations we have worked so closely with to make sure we were aligned, learning from each other, and supporting each other. And to all the citizens of the City of Bowling Green and City of Huron that's supporting our Firelands College campus and our main campus here in Bowling Green, I want to thank you for also being a part of this community as we've worked together to find a way forward. So at this point, I think we open it up to the questions that some individuals provided some questions ahead of time, and there's other questions coming in. So we'll just open it up for questions, and we'll go from there. So again, thanks for joining us this evening. First question.
Ronnie, we're getting a lot of questions regarding course modality for fall semester. More importantly, can you expand on remote options, in-person options, blended, and also a timeline? When will students be notified for their course schedule for the fall?
Great. So our returning students they should have their course schedule, or you should be working on those course scheduling as we speak, but most of you already have your schedule set. There were 3 modalities, in-person, hybrid, and remote. In-person is what you would expect in-person to be, face-to-face in a physical classroom, and the entire class is a face-to-face experience. Hybrid is a combination of some virtual and some face-to-face. So every student in the hybrid course will have some face-to-face, but they will also have some virtual. Many times, because of the physical distancing requirements of 6 feet that we used when the schedule was originally planned for, we had a capacity issue of how many students we could put in a classroom. Therefore, we needed a part of the class to be virtual, part of it to be face-to-face, and we called that hybrid. And then finally, the last modality is called remote, which is synchronously being delivered. It's very specific on when the class will occur, Monday, Wednesday, Friday, at a certain time, or Tuesday, Thursday, or Monday night, whatever, a very specific time, but it will be delivered virtually, much like we are communicating through this broadcast. So those were the 3 modalities. Now, we also have a whole variety of online courses that support a variety of our undergrad and grad degrees that are offered virtually online. And there are many academic programs that have always offered some online courses. Online courses will continue to be online courses. So if you're signed up for an online course, we assume you went into it assuming you wanted it to be online, and it will continue to be online. But the modalities that are changing are in-person, blended, and remote, okay? In-person, blended, hybrid, remote. And so what will change is these new guidelines that allow us to shrink the physical distancing. We now have the classroom capacity to move many of the remote and the blended hybrid to in-person. And that is what we will do. Except for some courses where for pedagogical reasons, it makes sense to keep a component of the course to be virtual. We've learned that there are opportunities to engage world-class faculty throughout the world that can teach some classes or components of a class to our students right here in Bowling Green or in Huron, Ohio at our Firelands campus. Those sorts of opportunities we don't want to lose in a post-COVID world. But a very large percentage of these courses will be changed, and you will know what that schedule begins to look like by mid-June. We're going through all the planning right now, and we should have everything kind of finalized by mid-June, where that will be, you can go online and look at your schedule and see those changes in course modalities.
And follow up, courses scheduling is changing. We talked about remote and blended in-person. Student wants to change their schedule. First point of contact, what's the guidance for students who want to stay remote specifically because of health concerns or want to move to an online format?
Yeah, so as we make these changes, and again, we thank you for your flexibility and adaptability as we work through this once again to make planning changes and according to the health protocols in place. So once those courses flip this summer, if you look at that and you're saying, well, I may want to adjust this course or that course for the fall term, returning students, you've got your academic advisor that you're aware of. Please reach out to that academic advisor, or you can go online and make those changes yourself. For the new students coming in, a lot of that will be covered in the SOAR registration in this summer during our orientation and registration. And when you are coming in for your first SOAR sessions throughout the summer, those courses, the course modalities will have already been decided, so you'll be able to choose the approach that you feel most comfortable with.
Last academic year outside the classroom looked differently. We're talking a lot what summer and fall will look like. Speaking outside the classroom, we're getting questions about what education abroad will look like if that resumes, big, large-scale events, homecoming, family weekend, and also just student life in general. Can student organizations resume their pre-COVID activities and events?
So I'm going to In a second, I'll flip it over to Ben to talk a little bit about just some specific protocols we may have in place for those really large events. But in general, here's what I can tell you. It will be a very robust fall offering. Parents' Weekend, Family Weekend, I should say, and Homecoming have already been announced, and we plan to have very robust programming in that area, welcoming back alums and friends of the university for Homecoming, and certainly families and our newest families that are a part of the Falcon family, welcoming them for Family Weekend. We'll also get back to everything from the fall convocation for our entering class. We are doing some planning for fall 2020 students who didn't have the typical convocation experience that their past colleagues and future colleagues would have had. So we're planning something kind of special for the fall 2020 students. So when they return in fall 21, we're going to have a little welcome party so they can have their own fall convocation. But the point is, some of those great traditions that have defined the Bowling Green experience, we want to make sure we get back to, which is bringing people together, an opportunity to learn from each other, an opportunity to engage with each other. Study abroad is something that we're continuing to look at. We believe there could be an opportunity. We can't say anything right now, but we are working to try to find a way that there will be at least some study abroad opportunities potentially available in the fall. There again, we cannot promise anything right now because some of that has to do with international kind of the give and take between the countries and what's allowed in terms of where you can travel to and such. But we are certainly looking at that and are very aware of that because we know that's one of those experiences that we are very proud that Bowling Green State University has offered all of these years of opportunities for students to go to other parts of the world and live and learn. But we want to make sure that's done in a very safe way. So those are some of the things that we're still trying to decide, but it'll be based upon, once again, kind of guidelines from CDC and then also guidelines from the other countries that would become our partner countries in terms of doing study abroad. Ben, anything you want to add to that?
Yeah, I'll add that, when we look at that, it certainly is a country-based perspective. We know that every country is at a different place with how they're navigating COVID-19 and the resources that they have. Not every country has the same vaccine resources that we've been able to roll out. And so I think this will take time, and we'll have to really study each country individually and what those restrictions may be as we make those decisions. At the same time, when we look at events here, we really want to make sure that, again, I think we're trying to be as limited on restrictions as we possibly can. I think we're going to have great opportunities to be pretty fully open, but then also be respectful of those individuals that maybe still want a little bit of distance or still choose to wear their mask. And so in those large event settings, we may have some spaces that we can set aside for individuals that still want to physically distance from a large group. But if we can hit high enough vaccination rates, our case numbers should be so low that we wouldn't really even have to worry about any restrictions whatsoever. We're going to be rolling out a voluntary program for individuals to submit their vaccination status to us. And the goal behind this is to really just study population health, is to be able to confidently say, here's the percentage of BGSU faculty, staff, and students that are vaccinated, and this is why our case numbers are so low. I think public health in general is going to start to respond in a more really honed-in fashion where we're really looking at cases by certain areas. So if a certain zip code or a certain population is seeing higher cases, it may not necessarily impact restrictions in other areas of the local community. If it's only one school district that's having an outbreak, it doesn't make sense to restrict everybody. And so I think we're going to really have some tools in public health to really kind of be much more precise in when we have to bring out things like the masks again. And maybe it's only for a very limited period of time until we see trends and numbers turn around very quickly, and then we can open back up again. I think with the high vaccination rates, the hope is we don't even have to have any sort of restrictions whatsoever.
Thanks, Ben. As you can imagine, we're getting a lot of questions regarding health for COVID-19. I'm trying to thematically approach this, but I guess we'll start with vaccines. You previously stated that BGSU will not require students, faculty, or staff to get the vaccine. We mentioned previous messaging about incentives. What will that look like for the BGSU community? I guess also in the same perspective, if a student wants the vaccine, can BGSU assist there? And also, we've done vaccine clinics. There's been talk about the booster. Would BGSU be involved in distribution of that as well?
Yeah, great questions. And so where we want to emphasize is we will continually work with the local hospital systems and the health departments to really make any sort of vaccine available, whether that's students coming back in the fall. We will have vaccine clinics to the demand that we're seeing. Same thing if booster doses would come out at some point in time and be recommended for our community populations, we would make those as readily available and as convenient as possible. I want to make clear that we've partnered with our local health departments and hospital systems to try to make vaccinations as convenient as possible. And so truly to the point where if you want a vaccine and you're struggling to find it, reach out to us through that health@bgsu.edu email, and we will work to get you signed up to the easiest way, the quickest way for you to get vaccinated. So that's first and foremost the way that we can really help everybody to move forward. At the same time, with that sort of vaccination program being voluntary, we want to make sure we get enough people to submit their status to us, because that's how we know it can be accurate. And so that's where those incentives come into play. We're still talking out the details of what that will look like, and we want you to be creative. If you have suggestions for us, feel free to email those suggestions, and because we'd like to hear that feedback as well of what would intrigue you. And so I'd like to make this fun as well, so that we can creatively come up with some incentives that we can make sure we're all doing our part. The more of us who get vaccinated, the much more open we can be in the fall semester and not have to worry about any restrictions, and it's the quicker aspect of how we can move forward. We're seeing great progress in this summer, and now even with categories opening up to younger individuals, 12 years old and up, I think there's some optimism that sometime in the fall, those categories may even move down to children as young as 6 months and older. All of these things help protect our communities so that we all can move forward with this. And so I think that's the way that we're planning, and definitely we want to hear your feedback on those items.
Ben, before we get to questions about testing and quarantine and isolation, there's a couple more vaccine follow-ups. If an individual recently recovered from COVID-19, will BGSU accept an antibody test instead of proof of being vaccinated?
Yeah, so based on CDC guidelines, we will not accept an antibody test, in place of proof of vaccination. Ultimately, the CDC still recommends that individuals who have had COVID-19 or their status is uncertain because of a positive antibody test, they still recommend that those individuals go ahead and get vaccinated. And so we would operate from that CDC guideline to really make sure that people are getting that vaccination and getting that full coverage. And so that's where we'd really want to be clear from the antibody test perspective. At the same time, if somebody has a genuine medical reason, we probably would have some sort of accommodation that they could submit to us from their physician, that we'd be able to, around those voluntary incentives, be able to still put them in that program, because we don't want to exclude anybody because of that medical condition.
Great. On the vaccine lines, we'll kind of transition a little bit into housing. Will vaccinated and unvaccinated students be separated or paired in housing? And also, is there an opportunity like this past fall semester to do a single room for housing based on comfortability level and vaccination status?
Yeah, so these are things that we're discussing based on demand. Most likely, the pairings will occur just like they normally do. And so ultimately, we want everybody to feel safe, but those vaccinated individuals really should feel comfortable in their protection levels. Now, there may be some other reasons why they may want to request a roommate who's vaccinated, and we may be able to accommodate that, but really it's going to be based on those number of requests as to whether that can actually be accommodated or not. Same thing with the request for a single room. I know that there's some concerns because usually a single room has a higher cost to it, and so these are things that we would have to assess and discuss, and we appreciate that feedback for us to really look into those topics with our Residence Life staff and be able to get those responses back to you.
On to testing, you mentioned it briefly in your opening remarks. Will testing programs continue for the fall semester, the randomized surveillance that we did last academic year?
Yeah, so our expectation is we're going to continue to make testing widely available for faculty, staff, and students. That worked really well for us throughout this last academic year. You know, our partnership with the Wood County Hospital and with our own medical laboratory sciences program that was able to really stand up our rapid testing and offer tens of thousands of tests is what helped us to confidently collect that data and be able to really track those case numbers. That testing will still be available in the fall semester as well. The decision to have to do randomized surveillance testing will actually really come from our case numbers. If our case numbers are low enough and we're watching what's going on within the general community and our vaccination rates are high enough, there may not be a reason to do randomized surveillance testing. That may only come into play if we start to see those case numbers rise and we want to really start to look at different populations and see where are those cases occurring so that we can shut down any spread very quickly. That may be the time where we make the decision to bring back that randomized surveillance testing. But ultimately, we're going to use the data and our partnerships with public health to help us inform those decisions.
Ben, going back to you with more questions. Is SOAR's coming up in the summer? Can you expand on what that's going to look like for our students and their guests?
Yeah, absolutely. So that's going to be one of those situations where we want to have a social experience for SOAR. So ultimately, we will have some settings and some of the sessions within SOAR. We will have a large group of students and families together. In those settings, we're going to still provide some distance, but it may not be the full 6 feet of distance. And just with the sheer number of people in our ballroom in the student union, we're going to recommend that families wear masks during that setting and that session. At other times, when those sessions are occurring in other groups where people are spread out, no requirement for masks in those sessions. And at the same time, anytime you're outdoors, no requirement for masks. We've learned that outdoors, we can do a lot of things where we don't have to worry about the spread of COVID-19. And so we're going to have sort of a blend of different scenarios. And our individuals who are leading those SOAR sessions will be able to recommend for you when it may be time to put that mask on or when you're free to take that off. And so, we ask everybody to be respectful of other families that are coming to have that BGSU orientation experience. And I think we can come together and have a really great orientation.
Getting a lot of questions about quarantining and isolation. How will isolation look for people who test positive, and then also those who are exposed who maybe already be vaccinated?
Yeah, absolutely. So I think that's one of the biggest key points to really talk to our students about is one of the most benefits of getting vaccinated is if you are fully vaccinated and you have any exposure to a positive case, and we follow the CDC guidance and the Wood County Health Department guidance of an exposure being within 6 feet for greater than 15 minutes of a positive case up to 2 days before their symptoms start. If you're fully vaccinated, you don't have to quarantine. You don't have to go through that contact tracing process, and you can continue on attending class, participating in sports, participating in your organizations. You don't have to shut things down for 2 weeks and sit in a residence hall room or stay in your room off campus. And that's the greatest benefit, in my mind, to vaccination. Unfortunately, unvaccinated individuals will still fall under that contact tracing protocols, and that's the CDC and the Wood County Health Department guidance and regulations. We as a campus have to follow their standards, and so if an unvaccinated individual would have that same exposure, it would operate the exact same way as we did this last academic year. If you would test positive, you're going to have to isolate either in our isolation space for 10 days or go home and isolate and miss out on all those great campus activities for that 10-day period. If you would have that exposure to that positive case, it's potentially up to 14 days depending on the scenario and what activities you want to participate in. And so we really don't want any student to miss out on any of these experiences. And so that's really the great benefit to being vaccinated, and you don't have to worry about these things.
Does BGSU still plan to report case counts for its community this fall? And then what does contact tracing look like for the fall?
Yeah, absolutely. So we still plan on having a dashboard, and because much like we're monitoring, we've heard loud and clear that our campus community has really looked to that dashboard to help inform their own decisions as well. And so we want to show everybody what that data is and be very transparent in why we would be making the decisions that we're making. So we want to be able to see if there's trends of our community cases going upward, why we may come out with a recommendation that in closer large event settings, the masks maybe should come back out for a week or two so that we can see this trend turn downwards again. We want to be ready to be responsive to that, and so we will continue to provide those dashboards in the fall and be responsive to the concerns and the questions that we're getting from the community. At the same time, contact tracing is, we had our own contact tracing team, and we worked directly with the Wood County Health Department and the Erie County Health Departments to do that contact tracing. Having our own team will really be dependent on the number of cases. Right now, the cases are so low that the Wood County Health Department can handle that contact tracing themselves, but we're always ready to pivot and stand up our team to assist. And so that if we get to a point where we need to bring that team back out and assist because of cases, we're ready to do that as well. At the same time, if you're a vaccinated individual and you're in the statewide database, the Wood County Health Department, if you come up on a list for contact tracing, they can genuinely check to see if if you've been vaccinated, and that then maybe that contact tracing wouldn't apply to you and it wouldn't be a requirement for you to quarantine, and they would have that information right up front. And so I think we're going to see a very different method of contact tracing because those vaccinated individuals will not fall into that contact tracing process.
Then a couple of final follow-ups, and then we'll give you a break for related to housing. If individuals have a vaccinated and an unvaccinated are in the same room, would they have to be required to wear face coverings or kind of function like they did last academic as a single household unit?
Yeah, absolutely. So in that particular setting, where you have roommates and maybe one's vaccinated and one's unvaccinated, we wouldn't have a requirement that the unvaccinated individual has to wear a mask within the room. That nobody would want to live under that standard. And so honestly, those two individuals are going to function as a family unit, much like we did for quarantine and isolation. If one student would come down with symptoms and test positive, the roommate automatically, then needed to quarantine at that point in time. With this, it'd be a similar scenario like a household situation. Now the hope is the vaccinated individual is actually going to provide some level of protection to the unvaccinated individual, that we wouldn't expect the vaccinated individual to, the risk level for them bringing the COVID-19 virus into that house situation would be much less. And so it provides some benefit. And that's where, we'd still advocate though for that unvaccinated individual when they're out in public in large gathering settings, that they would still want to protect themselves by wearing that face covering or keeping some social distance.
Okay, President Rogers, I have a couple questions for you. One going back really to the modality and the remote teaching for students. A lot of questions about students who still need to be remote for health concerns. What are their options? How they navigate that.
So, one of the guiding principles that we've had from day one is, how do we work with all the members of our community to kind of find a way forward and try to be flexible and adaptable when we can. So there will continue to be online courses that we will have, and there will continue to be some remote courses where the pedagogy is appropriate and on the blended side. But there are what I can't guarantee is that we will do a full schedule that is fully remote or online. Although we've got a lot of different online degree programs offered at Bowling Green State University, and certainly those degree programs are fully virtual. But what we want to do is work with our students, especially as we're coming out of this pandemic, because we know, there's a lot of light here at the end of the tunnel as we're coming out of this. But we know that there is this period of transition that we have to go through together.
A lot of questions about BGSU dining looked differently last academic year due to COVID. We have some new establishments opening up. There's some exciting new changes for our students, but can you expand on what dining will look like?
Yeah, so, the BGSU dining, certainly we know what that was like this past year. There again, we followed all kinds of health protocols, and in fact, we were able to continue to provide, dining services obviously during this past year. Moving forward, here's what we know is that we're back to, fully open. The two res halls, or the two dining halls, that all you care to eat dining halls, will be back to pre-COVID sort of delivery. We've got several kind of exciting new options. Einstein Brothers Bagels is moving on to campus. We'll have that open in the fall. That's replacing the Dunkin' Donuts, because for those Dunkin' Donuts fans, though, we have a Dunkin' Donuts now off campus here in Bowling Green. So it's giving our students more options, more opportunities. Pub 1910 is opening this fall. That's in the Union. And then we'll also be changing out a couple of different items in the Falcon's Nest in the food court. More details on that later, but you'll see this fall when you arrive. So those are some of the examples. Our plan is to get the teaching kitchen back open. Pre-COVID, that was a very popular program for students to come in groups and learn to cook and make different dishes together and have an opportunity to do that in a teaching kitchen. And so certainly the planning is to bring that full, much like it was pre-COVID, to bring that back fully in person in this fall term.
Starship was very handy during COVID. Will that continue?
Yeah, Starship, as you know, was something that actually got rolled out about, I think it was 7 days prior to March 9th when the governor declared the state of emergency. And in many ways, we're very fortunate because that was a wonderful service that delivered across the campus and also expanded into the city of Bowling Green and delivered things off campus. And so those services will continue, and it's been very, very popular indeed, and we want to make sure that we continue to provide that service.
Ben, getting questions about physical distancing, 3 feet, 6 feet, clarification on that for not only outside the classroom, but also inside.
Yeah, so generally what we've learned is any distance is better, right? As the more we can spread out and the more we can space out, it provides less opportunity for spread of this virus, especially amongst unvaccinated individuals at this point in time. And so 6 feet is still going to be the standard for the classrooms this summer. That's what we were set up for, that's what we were planning for, and that's what we're still able to provide. We anticipate, though, that in the fall, we'll be down to much closer proximity. Always having the opportunity to start to recommend distancing if we need to bring that back, but we think that would probably be a further down the road step of having to space. I honestly think that the easiest initiative that we could bring back would be masks first and foremost, and I think that would have a huge impact. I think what we learned from this pandemic, that just those masks alone can really make such a difference in preventing the spread amongst susceptible communities. And so now we're reaching a point where we have a much less susceptible community. And the benefit around that is even one vaccinated person can actually provide distancing in where they're sitting between other unvaccinated people. And so a couple of vaccinated people sitting between unvaccinated people now creates that distance barrier even without the masks. And so I think that's something we'll be continuing to watch and monitor. And whether at some point we would have to have 3 feet of distancing because of cases, we'd be ready for that. But I think because of vaccination status and getting high vaccination status, we hopefully don't have to go down that road.
Getting questions, I think this is for both of you, getting questions about just support of our students. Last academic year, we instituted some measures, the flexible grading policy, increased mental health services with the telehealth. What stays as we look to the fall semester for our students?
Maybe I'll kick that off and then go over to Ben. A couple of things. there was so much, so many challenges over this past year as we have found a way forward, and successfully found that way forward here at Bowling Green State University. But there are some things that we want to make sure we take away that we've learned that will make us a better university post-COVID. And one of those things, it seems to me, is thinking about all of the support services that we have and making sure that there is an alignment of those support systems that we have here at the university, but a very student-centered approach to those support systems. So part of when Ben was hired and joined the university as our chief health officer, his focus really over this last period has been very much about public health, specifically COVID-19. How do we ensure that we had robust testing? And we were very pleased that we were one of the few universities that had this stand-up PCR testing available because of the partnership with Wood County Hospital, and we could get rapid results. And then the rapid testing, and then the partnership with the Wood County Health Department in the large-scale vaccination clinics that we set up at the field house. All of those things were to make sure that all of our community, both here on campus but off campus as well, on this campus as well as the Firelands campus, that there were these support systems in place. So Ben's role, though, is evolving, and it's a very natural evolution in my mind. And so in a role as a chief health and wellness officer, the counseling center, accessibility services, our partnership with Wood County Hospital for the Falcon Health Clinic, student insurance, all of those areas now are aligned under Ben's division of health and wellness. And the goal there, and I'm going to let Ben speak to that, the goal is to have a very individual student-centered approach. And we have learned a lot on how we can use telehealth, for example, in the counseling center. How do we fully leverage not only the assets at Bowling Green State University, but the community assets that may be available that can support our students? So it's a very exciting initiative of this idea of making sure that each member of our community, students, faculty, and staff, have access and that know about services and support services that are available for them. But Ben, if you might want to chat a little bit more on that expanded role.
Yeah, thank you, President Rogers, and I 100% agree. I think the transition that we're looking to see is really start to focus on the progress that we've made in building these partnerships from a health and wellness standpoint, and then also how do we carry that forward and take all of the good things that we've learned throughout this and how we can support students and faculty and staff and their families and really continue that forward. And so we've had opportunities to actually add staffing to our counseling center and add some new programming within the counseling center. We're going to see that continue to ramp up even as we look towards the fall and into the future. We've had opportunities for increased health educators and wellness programming. And so we really want to capitalize on that and build a system where throughout this last academic year, we created the health@bgsu.edu email, and we had a lot of people reach out with COVID questions. I want people to reach out with their general wellness questions so that we can help steer them in the right direction. Especially for students, we want to take your time here and not only give you those tools to have a great career, we want to give you those tools to have a great life. And a huge part of life is your well-being and your health. And so we really want to start to focus on some of those initiatives and how my team can really help coach and model some behaviors so that you take that with you even after you graduate and move on from BGSU, and support that going forward.
Great. We're getting a couple more questions about, and I think we covered this, but we could revisit. Does Firelands fall under these health protocols and approach? And also sporting events, commencement this summer, what do those look like?
Yeah, so absolutely, Firelands falls under the same protocols, and we'll be monitoring in the same way, but in a little bit different fashion, working with the Erie County Health Department and the hospital systems in Erie County. So we may have to, much like we talked about having different zip codes in Wood County that may have to do different things, different school systems. So, the BGSU main campus may, based on cases, have to change some protocols that wouldn't apply to Firelands, but throughout the summer, we're certainly going to have the same protocols as we open back up, and as we look towards the fall of having fully open semesters. Firelands has some things where they don't have the residence halls there, that we may have to make some modifications where they can being in person may be a little bit different, but ultimately right now the protocols for the summer would mirror each other. When we speak to the large events like sporting events and things along those lines, the state of Ohio has dropped capacity limits for indoors or outdoor events, and that goes into effect on June 2nd. And so we're going to mirror that, where we won't have capacity limits, but if in that large setting, if we would have an arena, or a stadium where we're going to have an event and we're going to have large numbers of people during the summer, that recommendation to still have that face covering if you're indoors would still hold. The hope is come the fall, we wouldn't even have to have that face covering recommendation at that point, and we just make that optional for individuals that choose to have that.
I want to revisit just briefly the voluntary vaccination program that we're rolling out. A lot of questions and comments about student privacy, ADA concerns. Can we clarify that it's not about participation, how the community?
Yes, absolutely. So the goal for this is to get a population health data metric of what is our general BGSU community's percentage of vaccination status, because that can help us to make some decisions on even messaging. Do we have a high enough percentage that we maybe need to continue to campaign or continue to offer incentives to drive vaccination numbers? But we won't be using that information for sort of individualized decisions, in that it's a voluntary system that people can submit that status to us. When someone is walking across campus, no one will know what their vaccination status is. We don't have any way, and I think the CDC in the state of Ohio sort of mirrors this in looking at some of these things, that it truly is sort of a personal responsibility to make those decisions for yourself. When someone comes into a building, whether they're wearing a mask or not, we may not necessarily know their vaccination status, because we're not looking to collect that at that individual level and say, oh, well, we now have you on a roster, and so when you step foot in this classroom, you need to have a mask on. It's truly that personal choice, but we've gotten great compliance throughout this pandemic. People did the right thing that really helped us to move forward, that helped protect our communities and help protect themselves, and we expect that same level of compliance as we look towards the fall semester.
Ben, does rec center and intramural sports, club sports, that fall under the health protocols that we talked about tonight for the fall?
Yeah, so essentially with those types of activities, we will be mirroring the state of Ohio's guidelines around face coverings are not required for any individuals with participating in physical activity. So individuals participating in, at the rec center, playing basketball or participating in any of those fitness classes would not be required to wear face coverings, but we still would ask you to try to maintain that 6 feet of distance. And so if you're working out at the rec center and you're not vaccinated, you can take that mask off, but the recommendation would be is then when you go to, walk to the next machine, or come off the court, that again, you put that face covering back on when interacting with other individuals, just to try to protect yourself and protect those other individuals using that space. But outside, generally we probably won't see people participating in physical activities wearing face coverings as well.
A few final questions. Got a lot of comments about what if cases go up, and you talked a little bit about that, and most, they're also commenting on variants and how are we monitoring, how would we adapt and be flexible to respond?
Yeah, absolutely. So again, much like we've done throughout this pandemic, is we are continually looking at the CDC data, looking at the Ohio Department of Health's information, looking at actually the World Health Organization and what's happening globally and any variants of concern that are popping up in other countries, and then really looking here locally and informing those decisions based on all of those metrics. At the same time, we're ready to respond. The Wood County Hospital, President Rogers mentioned the PCR machine that our partnership, helped to set up. We're starting to look at that system has the potential to be used to actually type variants and start to monitor some of those things here locally. So while the testing demand on much larger scales may be starting to shrink, the demand for that testing when we do have a positive case to actually type it for the variant that we're seeing is starting to actually come to pass and give us another tool that we can use to combat COVID-19 into the future, as we may see more variants that pop up. At the same time, we're ready to sort of watch those numbers and respond appropriately. We may start to see public health messaging that sort of mirrors just best practices for keeping us all safe. It was a great trend to see that we hardly had any influenza cases this last, what would have been a flu season, but because of certain public health practices like the mask wearing, hand washing, and distancing, and limiting some events, we really didn't see those cases. Some of these public health practices may come back to be recommendations as we approach what would be an anticipated flu season, cold season, and COVID season. We should all be operating from the standpoint of, if you're sick at all, stay home. This is something, a positive trend that we all should keep with us, because we know whether I have the potential to spread, COVID-19 or influenza or cold virus. We don't want to do that. We don't want to impact other community members. So we all can take these precautions and actually move forward even better than we've had in the past during particular seasonal influenza or seasonal allergies or other pieces that we can know exactly what we're dealing with.
President Rogers, throughout COVID-19, we've enhanced communications with parents and families. What does that look like going into the fall semester? We did the Chief Health Officer emails, the video Q&A series, your presidential emails for Fridays, and keeping parents and families and students informed.
So, to answer that, I want to start by saying that, part of this is what we have learned during this past year and what we're going to carry forward. While we were always proud of the way in which we engage the entire Falcon family, the family and the parents of our students and their friends and others that support them, we learned that we could even do a better job, and that's why we created an office for family and parents and new student connections. And that office, Amy Swank is running. We did a town hall with her earlier. And that will be an important way that we're communicating with all of our parents, all of our family members that support the Falcons, their Falcon here at Bowling Green on either of our campuses. So it's important that we continue to grow out that robust. The other thing we learned is an opportunity to make sure that we are as transparent as we can be and that we're communicating constantly with the audience. And this past academic year, we had some very challenging, tragic incidences that have occurred on this campus. But let me tell you that our promise to all the members of our community is to ensure that we are communicating, that we are being transparent, that we're sharing this information. Because each and every single member of our community, whether it be a student, faculty, staff, we are thinking of how we support a community where all can belong. And so it's important that we continue to communicate, be transparent. Now, I was sending one email every week, and some of you probably are getting a little tired of an email from me every week. So it may not be every week, but I would like to continue to have opportunities to communicate with our entire extended family and certainly the Falcon family. And from a health protocol and the sharing of information, from the Chief Health Officer, I think it's also good practice that we're sharing with the broader community, where we are in terms of the health of our community, the wellness of our community and the various programming that may be occurring. Earlier, you had asked a question about the rec center and the wellness programs. So the wellness programs are another aspect that we'll be working with Ben to ensure that we've got alignment around mental health, physical health, food and nutrition, and making sure that we're thinking about every member of our community and how do we help each of you think about your own well-being and what you can do to support your own well-being, but how do we make sure that our programming is aligned to support you to be successful here at Bowling Green State University. So communication will continue, of course. These kind of town hall meetings, we've learned during COVID that there's opportunities like this to host host events like this where we will get your input, your feedback. It goes back, we take those questions, we look at the themes of your questions, and then either rethink about how we're communicating or even make some adjustments in some of the decisions we've made based upon that. So I think we've learned a lot about how to ensure that we continue to be transparent and that we have robust communications with all the members of our community.
Ben, before we turn it for final comments, one last question. Talked a lot about what BGSU looks like for summer and fall. Bowling Green's a true college town. Can you offer some perspective on what the city will look like moving forward?
Yeah, I think we're in a point where I think we're going to see a lot of changes over the course of the summer. So each business under the governor's orders has been given the ability to make decisions for themselves as to what protocols they'll have in place. Back to that respect and compassion, we ask each person to sort of respect those businesses, and so some may require face coverings, some may not, and some may still have their staff, their front-facing staff, or cashiers, or individuals, servers who are working, waiting tables and things like that, may still wear face coverings, some may not, and so I think we all want to be respectful as we learn to navigate this together over the summer, and then definitely, especially when our campus really starts bustling in the fall, that's probably going to be a pretty large influx for these businesses, and it may be a new point that they'll need to learn to navigate comfortably, and so we just ask everybody to be respectful for that. But I imagine most of these businesses will probably be pretty wide open. I think if we can continue to drive our case numbers down here locally, everyone will feel very comfortable in interacting and having very open activities and open businesses. And that's where we want to get to. And I think the more we can all work together to make sure that those case numbers stay low, that our hospitalizations stay extremely low, which we're starting to see now. Those are great trends. In the past, public health really worked to offer recommendations and guidance, but it really came down to those individuals making decisions for their own risk levels and the decisions in their life. And that's where I see us getting to come the fall with navigating with some of our local business communities as well.
Ben, before I go to the president for some final comments, anything else you want to add?
Yeah, I think to that point of, public health always operated in the background before this pandemic. It was always there supporting, monitoring, doing this work, trying to help to keep people safe, and offering education. And that's where I see us starting to change to. I think we've gotten used to, over this last this last year and several months, to regulations. And those regulations are going away now. Public health doesn't like to force. We don't like to regulate and enforce. We want to work through education to have the community work with us to be able to make sure we're keeping everyone safe, but at the same time allowing people those freedoms. And I think we're moving back towards that standard of public health, but we will still be there in the background monitoring, offering that data and really making sure that people are having the best information to make those informed decisions going forward. And so we look forward to a more open fall and being able to continue to serve that role well into the future.
And I want to thank you for joining us this evening and to tag on to Ben's comments there. I think, a key learning for me is, how do we ensure that we're balancing the health of our community, the public health, and also thinking about empowering people to make decisions. And so that is, for them to make decisions. And a part of a university is about education, about debating ideas, discussion, learning from each other. And so in many ways, I think this whole pandemic, as we've worked our way through this, what has been so successful at Bowling Green has been our ability as a community to come together in a respectful way, in a compassionate way for all members of our community to find this way forward. We have absolutely learned about some things that we're going to keep. Winter Wonderland was for those students that were here in the spring term in January, February. We learned, even though the weather was kind of cold and a little windy, we learned we could still do things outside in a very safe way. The fire pits, we learned that we could do things and gather together outdoors and kind of celebrate the fact that we're in a northern climate of the United States. We learned about ways in which we can use technology to bring a lot of the activities to this campus everywhere to the world. My wife and I attended several theater productions, several dance recitals that were broadcast across the world. And so families and friends of those performers had a chance to see them. So there are things that we have absolutely learned. A couple of faculty members have told me, I'm always going to have a virtual office hour option where students that I'm going to absolutely have in-person office hours, but I'm going to also put it on Zoom so students can dial in while I'm having this conversation with in-person students and communicate. It led to a lot more students taking advantage of office hours, for example. I've had faculty members absolutely say, with this technology, I can bring amazing scholars and speakers into my class and engage with my students. We want to keep all of that because it will make us a better university, but more importantly, it makes this a better educational experience for our students. So we've got to make sure that we preserve community because we believe in the power of belonging. We absolutely want to provide our students even more opportunities to stand out and achieve their potential. Work hard, be nice, work hard. It's amazing what can be accomplished here because ultimately we want to send you out when you graduate from this institution, whether you're an undergrad or grad. We want to make sure that when you leave this institution, you are prepared to go out and do amazing things. And the public health, as a public university, we do have this obligation. There is an obligation we all have as citizens of the United States, citizens of this world, to kind of come together, to work together, to think about, absolutely, it is about individuals working hard and having success, but it's also about the opportunity to be a part of this community and to support each other. And so if nothing else from this COVID experience, this global pandemic, how important it is for us to find ways to work together. And again, I started today's town hall by saying this, and I want to reiterate how thankful we are for all of our students, our faculty, staff, and our families, that this past year we came together. We found a way forward that will make us a better university this fall, and we will continue to move in that direction. And so thank you. Thank you for your involvement, your engagement, and to our newest students who are arriving this fall, I look forward to meeting you at an orientation this summer and certainly in person this fall as we welcome our newest part of the Falcon family this fall. Again, thank you so much for joining us this evening. I want to thank my colleague Ben Beatty to be here that is with us. Any additional questions you might have, president@bgsu.edu. Feel free to send those questions, or health@bgsu.edu for any specific questions on COVID-19 and health protocols. Have a wonderful evening, and as we like to say here at Bowling Green State University, I Ziggy Zumba.